And while the province looks for ways to get more people vaccinated, some individuals are looking for ways to sidestep immunization. Family physicians in Alberta are getting calls from patients who want notes exempting them from getting a COVID-19 vaccine. And one of those physicians is Dr. Mukarram Zaidi here in Calgary. And he joins us now, as you can see. Thanks for joining us, Doctor. You bet. Can you just describe the experiences you've had with patients who've been asking for these exemption notes?
So since the province so-called started proof of vaccination and not a proper vaccination passport, more and more patients are coming in to get a note of proof of vaccination or a vaccination exemption note.
Whether they should have them or not, and in many cases, people who are not eligible, correct?
Correct. So I would break these people into three separate groups. One of them would be we're on the borderline, they were debating to get or not get the vaccine. Now, since they have to get the vaccine, they're coming in to ask questions, specifically how would they affect their immune system, their different diseases. If they're pregnant, how would it affect the baby? And they are open to a discussion. And some of them do agree to get vaccinated, some don't. The other group is that where they are privileged. They somehow got a face mask exemption letter from a physician somewhere, and now they are looking forward to get a vaccine exemption letter or a letter that they have been vaccinated without being vaccinated. And they don't apologize for that. They don't really want to have a discussion. They're just in there to get the letter and out. The third group is where they are trying to bribe their way and kind of pay money to get an illegal letter as well.
And what do you say when that happens?
Well, the jaw drops, you get angry, but you have to keep your calm as a family physician, and you kind of try to reason with them. And when somebody is so below character, it's difficult to reason with them.
And so what happens if you refuse what is essentially a bribe, or you just turn the privileged people away? How do they react?
So when I turn the privileged people away, they start using false language, say, you don't know what you're doing, I want to check your medical degree, where do you get medical education from, do you know the Canadian healthcare system? All kind of derogatory stuff comes out, and then they leave the clinic and go on Google reviews and give me a very excellent review of who I am. The second was the gentleman that came in, the Caucasian gentleman who wanted to bribe me, asked me that, told me up front that he would compensate me for the letter. And I'm like, no, it's a medical legal letter. I will provide you without any fees. Just let me look at Netcare. He says, no, you can't check Netcare. I do not allow you to check my Netcare. I'm a patient and you need to trust me. I'm like, no, this is a medical legal note, so I do have to check Netcare before I give you the note. He goes, no, I do not allow you to check Netcare. I will compensate you for this letter, and I'll give you $200. Now, I'm like, what you are asking me is unethical, immoral, and borderline criminal. And he goes, no, you need to trust the patient. So once I decline to give him the note, he starts lecturing me about ethics in Canada, trusting the patient, how I need to get my education upgraded, and he doesn't trust me as a physician.
Sounds like there's some underlying racism in some of those comments, if I'm detecting it. So let's get to the harder matter here. Why do you think these folks feel entitled to come in and ask for a certificate of exemption that they don't qualify for and don't want to get the vaccine? What's underlying that?
The heart of the matter is that people have been getting mixed messages from the very beginning. And it starts from our Premier and then Health Minister that they didn't want to enforce a mask or social distancing for the longest time possible. And even then, the province didn't implement it. It was the cities that implemented it. Then a sitting MLA would not disclose his status of immunization, which kind of promotes that, patient told me that if he knows more than you do, Dr. Zed, he's an elected official, has access to information. So if he's not getting vaccinated, we shouldn't. So, and then in summer, we opened for Stampede. It was the best summer ever. We had no social distancing. And so people, instead of understanding that we are living in COVID and it's a pandemic, we kind of had all the mixed messages. Now when we have this proof of vaccination, they believe that it's one more government trick to do them to get vaccinated, but they don't really need to get vaccinated. And then they have all their theories on hand for them.
Well, hopefully this conversation will help clear some of that up. That's it. We're out of time for it. I wish I could maybe have you back on the show in a couple of weeks to see how things change. Dr. Zaidi, you open to that?
Sure.
Good stuff. I enjoyed the conversation. Thank you for this.
Thank you for having me.
Well, that's the look